Thank you for being here today. The topic that we're going to be discussing is the medical interpreting profession catching up with the other healthcare professions. So this is a very exciting topic for me because I'm coming to you as a registered nurse, having worked in migrant healthcare for a number of years and also in community health settings, and also as a medical interpreter, having been a Spanish medical interpreter in hospitals, outpatient settings, and home settings for a number of years. This is a really exciting time for the medical interpreting profession. There's a lot of energy and momentum moving forward, and there's so many things that have happened just in the past 10 years alone. We've gotten two organizations, a national organization and an international organization, that are helping to guide and steer the profession in many different ways. We have a code of ethics, we have standards of practice, we're going to be getting standards of training, we have annual conferences where we can all gather and learn from each other and get a chance to network. And this is just so exciting. From outside of the profession, there's also a lot of momentum and interest. So healthcare providers themselves are starting to use interpreters more. Most healthcare providers have had an opportunity to use a phone interpreter. Many have used a face-to-face interpreter. And now more and more healthcare providers are getting an opportunity to use a video interpreter. The most exciting thing to me is the paradigm shift that has happened within the healthcare organizations, which is that most people know now that when they have a limited English proficient or a deaf client coming in to their setting, they need to have a professional interpreter, somebody who is trained, somebody who has shown some sort of skill level, rather than using an ad hoc or lay interpreter such as family members or friends. So there's a lot happening, and yet still as a profession we're saying to ourselves, we're not being recognized, we're not being valued. We want the healthcare organizations and we want the public to recognize us as a healthcare profession. Maybe we want to get more money, maybe we just want a better status. Believe it or not, physicians went through the same dilemma just about 100 years ago. It's hard for us to think about that right now because we see physicians as having a very high status in the healthcare ladder. And even if we look at TV or film, we see physicians portrayed 100 years ago as still being quite important. But the reality is they were going through this dilemma as well. They were not well organized, and they weren't necessarily well respected among community members. Nurses, as a matter of fact, are the ones that provided most of the care to a community. So it was nurses that would go to homes and to community centers to provide vaccinations and other sanitation services. Midwives were assisting childbirths. And for the most part, nurses are the ones that ran hospitals.